What is the history of open-angle glaucoma treatment? Imagine a condition that quietly steals your sight without obvious warning. That's what open-angle glaucoma can do, and understanding how its treatment has evolved helps us appreciate the progress made in protecting vision. This form of glaucoma is the most common type, caused by increased pressure inside the eye that damages the optic nerve over time. The goal of treatment has always been to lower that pressure and prevent vision loss. Back in the late 1800s, the first treatments were quite basic. The earliest effective medication was eserine, also called physostigmine, introduced in 1876. It came from the calabar bean and worked by constricting the pupil and helping fluid drain from the eye. But it had side effects that limited its use. Moving into the mid-1900s, doctors started using drugs called carbonic anhydrase inhibitors, first introduced in 1954. These drugs reduced fluid production inside the eye but also caused some unwanted side effects. During the same period, topical medications like epinephrine were used to lower eye pressure, but many patients couldn't tolerate the side effects. The real breakthrough came in the late 1970s with the introduction of beta-blocker eye drops, especially timolol. These drugs effectively lowered eye pressure with fewer side effects, making them a mainstay of treatment. In the 1980s, doctors added alpha-adrenergic agonists like aproclonidine, initially for managing pressure spikes after laser procedures, but they soon became part of regular treatment plans. The 1990s brought a new class of drugs called prostaglandin analogs. These medications are now often the first choice because they are effective, requiring only once daily dosing, and tend to have mild side effects. They work by increasing the outflow of fluid from the eye, helping to lower intraocular pressure. When medications alone aren't enough, laser and surgical options come into play. Laser trabeculoplasty, developed in the late 20th century, uses a laser to improve drainage through the eye's natural channels. It's an outpatient procedure often used when eye drops aren't enough or are hard to tolerate. Surgical procedures like trabeculectomy, introduced in the 1960s, create a new drainage pathway for the eye fluid and are still used today for advanced cases. In recent years, minimally invasive glaucoma surgeries have gained popularity. These procedures involve tiny devices like stents or gel stents that help drain fluid with fewer complications and quicker recovery times. Some of these devices are combined with cataract surgery for added benefit, making treatment more effective and less invasive. Today, treatment usually starts with prescription eye drops, including beta blockers, prostaglandins, alpha agonists, and carbonic anhydrase inhibitors. Newer drugs like rho kinase inhibitors are also being studied. If eye drops aren't enough, laser therapy or surgery may be recommended. Regular checkups with an eye care professional are essential because glaucoma is a lifelong condition that needs ongoing management. Research continues into new drug classes and neuroprotective therapies that aim to protect the optic nerve beyond just lowering eye pressure. While these are still under investigation, they show promise for future treatment options. The key to managing open-angle glaucoma is early detection, consistent treatment, and regular follow-up. Although there is no cure yet, current therapies can slow or stop the progression of the disease, helping preserve vision for many years. Remember, always consult with a healthcare professional for personalized advice and treatment options tailored to your specific needs.